All right. So before I start, I want to show you what I've got open on my screen. Okay. First off are the slides. Okay. And then I also have this program. Okay. It's called Complete Anatomy 2021. This program is something you can download, and it's actually free to download. And thankfully, bones are free. If you want other structures like muscles and things like that, you would have to pay for it. But for our purposes today, the free version is just fine. Okay. And the cool thing about this program is it's 3D. So I can rotate this guy. Okay. It gives you a cool visual, like as if you're there playing with the bones. Okay. You can zoom in and out, see the whole body. Okay. You can click on certain bones. You can click on the vertebra. When you click on the vertebra, it'll tell you which vertebra you're looking at. Okay. Again, this is called Complete Anatomy. Okay. Feel free to download that. It works on computers and tablets. Okay. This is not required to download, by the way. You don't have to have this, but I'm going to use this while I teach you as well. Okay. And then lastly, I have this document open in which I'm going to be drawing on. Okay. This is your lab diagrams. Okay. So let's get started. First off, we need to define what the axial skeleton is. Okay. So the axial skeleton is going to include the skull, the spine, and the rib cage. Okay, so what I'm drawing here, this is the axial skeleton. This is what we're learning today. We're not going to learn the bones in the arms and legs today. Okay, so axial skeleton includes skull, spine, and ribs. Appendicular skeleton is what we'll learn in a couple weeks, and that's going to be the bones in the shoulder, the arms, the hips, and the legs. Okay. So just keep that in mind. Axial skeleton includes these portions here. So let's start with the skull. So these initial slides that you see here, they're really cool because they have all the labels in one place. So I like that this is in the beginning because you can kind of go back to the beginning and look at all the labels if you'd like. But what we're going to do is we're going to break it down slide by slide. Okay. So I'm going to skip this one for now. Okay. But these are all the bones and structures that we're going to need to know. Okay. First thing I want to do is talk about the main bones in the cranium. Okay. So here's the cranium. This specific portion here that's outlined with this box is the brain case. Okay. So I'm going to draw the brain case for you. I'm circling the brain case. This is the brain case. Okay. The facial bones include the jaw and the cheeks and the nose. Okay. So here are the bones we're going to learn from the brain case. We're going to start with this guy, the frontal bone. Okay. So here we have the frontal bone. You can see it's pictured in this like pinkish color. Okay. The frontal bone is a very special bone in human beings because the frontal bone is large in human beings. Okay. Through evolution, as humans developed and their brains got bigger and we developed intelligence, right? Our frontal lobe of our brain got bigger. Things that the frontal lobe is responsible for is like problem solving, a lot of motor skills, right? And personality, things like that some are unique to humans alone. So as humans evolved through time, they developed a large frontal lobe of their brain, and therefore their frontal bone had to expand to be bigger. Have you ever noticed if you have a dog, they don't really have a forehead? It would look kind of weird if they had a straight up forehead, right? Their forehead kind of just goes straight back, right? So it's unique to humans and primates like monkeys and stuff, but the frontal bone is fairly large. So let's look at the frontal bone here. Okay, this is the frontal bone. So we're going to label this guy here. You can follow along on your lab diagrams. The frontal bone. Oh, you know what? I should do it like this. Okay. Next, we have the the bones on the side. Behind the frontal bone, we're going to have the parietal bones. So this is a view from the side. This is a view from the superior angle. Who can tell me what that means?
The top.
From the top. Very good. So we're looking at it from the top. So you're going to have two parietal bones, a left and a right. Okay, and this is right behind the frontal bone. So if we come out, look at it here, you see the parietal bone. It's really large, right? Okay, so for this one, we're going to want to go to the next page and label this guy right here. Parietal. Okay, I'm not going to write bone next to it just because it takes up a lot of space, okay? But just assume that usually bone comes afterwards. All right, the bones on the side. What do you call this region right here? Anyone know? What do you call this in casual terms? What do we call
Temples.
it? The temples, right? So near this region here, we're going to have what's called the temporal bones. That's how I remember that. Okay, it's a little further back where you normally consider your temples. Okay, but that's a good way to remember it if it helps you. So it's going to be on the side. You see this purple area here? So let's highlight that. Here we have the temporal bone. Okay, and we're going to have a left and a right. There's going to be some structures that you need to learn. Like for example, the ear hole. It's called the external acoustic meatus. Okay, but I'm going to come back to these specific structures because first I want to teach you the bones of the brain case. So I'll come back to this, okay? But keep in mind, you have to learn the bones, but also the structures, the specific structures that are within those bones, okay? So we'll come back to this, okay? All right, and then the bone in the back of the skull is called the occipital bone. Now this is looking at it from a weird view. It's from the inferior view. As you know, that's from the bottom, okay? So you can see the occipital bone looking at it from the posterior side here. It's going to be this guy, okay? The occipital bone. The occipital bone covers the occipital lobe of the brain, which you'll learn later in the semester has to do with vision. Okay, so if something happens, if you take trauma to the back of the head, it can really mess with your vision. So that's the occipital bone. Let's see if we can get a view of that. Okay, we don't have a good view of the back, so we're gonna draw it here. Occipital bone. Okay, so those are the main 4 bones of the cranium. So what I want to do now is test you on that. So have your Kahoot open. You can open up a new tab or join with your phone. We're going to quiz as we go along today, okay? Someone in the chat found a link to download Complete Anatomy. Thank you for that, Jordan. Someone's asking, are these slides in our packet? I don't believe the slides that I'm going through, these PowerPoint slides are, but the lab diagrams should be, okay? Again, if you want to access those slides, go to the lab lesson and click Axial Skeleton Slides. Oh, all right. Sorry, I know that's really loud. It always starts off loud for some reason. give you another 20 seconds. Let me know if you're having trouble joining. All right. Oh. Latecomers. All right, we're gonna start, okay? It's okay if you couldn't join, just follow along. Okay? Remember, this is not graded. These are very similar questions you might see on your quiz and exam, okay? What bone is this up front? Awesome job, guys. So this is the frontal bone up front, okay? Just curious, for those of you guys that don't use your phone, do you guys use like a web browser and have two screens right next to each other? Or do you cycle between tabs?
I actually have two screens.
Oh, you have two screens. Oh, cool. Well, if you only have one screen, I recommend putting the screens next to each other, like making the width smaller and putting them next to each other. That way you can do it fast. Which bone is this? Good job. We have the parietal bones. Okay. And remember, there's two parietal bones, a left and a right. Okay. Where there's only one frontal bone up front. Very good. The bone in the back of the skull is the occipital bone. Okay, we're going to do one more. I want to warn you, we're going to keep this Kahoot screen open and we're going to come back to it, okay? So don't leave the Kahoot. Just keep it open. Good job. This is the temporal bone. Okay. Also keep in mind when you're doing this, one thing, if you're finding this really easy, instead of looking at the answers, see if you can, from recall, pretend like you have to write the short answer down, right? Because on your quizzes and exams, you don't have multiple choice, right? So pretend like you don't see the answers and you would have to recall it and tell me what bone it is without any word bank or choices. Okay? All right, so I'm going to minimize this screen and we're going to come back to our slides. Okay, if you noticed while we were studying those bones, there was these little lines in between each bone. So I want to go to that. Who knows what a suture is in a clinical setting? Has anyone ever had to go to the hospital and get sutures? What is a suture? Stitches, very good. So that's what they call it in a clinical setting in the hospital. Stitches are called sutures. So the brain almost has like these stitches in it, okay? And these sutures are what divide the different lobes that we learned, or the different bones in the brain, okay? So the first suture I want you to know is this suture here. So we're looking at the skull from the top. And you have a suture that runs across the front, okay, in the frontal plane. And that's going to be the coronal suture. And then you're going to have another suture that separates these two bones. What two bones are we looking at here?
Parietal.
Parietal, very good. So let's draw these two in. Okay, so here we have the coronal suture. I don't have a good view of sagittal, but it would be right along this line here, okay? So this would be the sagittal suture. Okay, two more sutures. The suture that divides the parietal bone from the temporal bone is going to be the squamous suture on the side of the head. And then remember, we learned the sagittal suture separating the two parietal bones. That sagittal suture is going to come down. Oops, sorry. That sagittal suture is going to come down like this and stop here. And then you're going to have a new suture take over that goes diagonally like this. And this is called the lambdoid suture. Okay. And that is separating the occipital bone from the parietal bones. So that's going to be this guy. What was this one here?
The squamous.
Very good. Squamous suture. Sometimes you see it as squamosal suture. Okay. Any questions on those sutures? Let's go back to our Kahoot. Ready?
Yeah.
Yeah. Thank you for the enthusiasm. All right. I know you have to pull it up again, so I'm just giving you some time here. Let's give it a shot. Gabby in the lead. Nice job, Gabby. Looking at this suture here. Very good. That is the coronal suture. What two bones does the coronal suture divide?
Parietal and frontal.
Very good. Parietal, frontal. All right, so I see how that might have been a little tricky. This is pointing to, and maybe the resolution is not very good since I'm streaming, but this is pointing to this line here, which is the lambdoid suture, okay? For those of you guys that answered sagittal, remember sagittal is up here and it's going up to the front. We'll see a better view of it. Which suture is this? Good, that is the sagittal suture, okay? So it comes straight down the middle in the sagittal plane. Remember we learned the planes? Sagittal plane, okay? So then you have this suture going across, and then these diagonal sutures here. Who can tell me which side of this is anterior? Which side is anterior, the top or the bottom?
The top.
Very good, this is anterior. And this is?
Posterior.
Very good, posterior. I think we had one more. Awesome job, guys. That's the squamous suture. Okay, so we've learned 4 bones and we've learned the lines that separate them. Questions on those? All right, so remember at the beginning, we talked about the brain case, right? There's 2 more bones that make up the brain case, okay? And that's gonna be the sphenoid and the ethmoid bones. Now this one's kind of hard to imagine because it's more inside of the skull, but let's take a look at them. Here is the sphenoid bone. It's actually closer to the temple, what you normally think of as the temple, but it's like the bottom part of the brain case, okay? So let's look at what the sphenoid bone looks like on here. Okay, it looks small, but it's actually pretty big. Look at how it's like inside of the brain. I'm gonna isolate it real quick so you see the shape. That's what it looks like. Kind of looks like a bat. Okay. So that's the sphenoid bone, all right? And if I were to take away these parietal bones, you can see what the sphenoid bone looks like at the bottom of the skull there. Okay. So it makes up the anterior portion of the brain case. So we're gonna draw this. This is the sphenoid bone. Oh, here's a better picture of it. My apologies for that. My phone says scam likely. Do not disturb. All right. The next one.
It might be important. Might want to answer it. Never know.
I don't know why it's continuing to ring. It's really weird. There we go. Okay. Okay, so that was the sphenoid. The next one is called the ethmoid bone. Okay, and this is going to be kind of on the inner part of the eye socket. It's a smaller one. So let's go to that. Okay, it's on the medial side of the orbit, which is the eye socket. And it makes up this tiny piece of the front of the brain case. Okay, and we're going to talk about what all these holes are. Okay, but that's the ethmoid. So we can draw it here. So now we've learned all of the bones that make up the brain case. So at the front, we learned these 6 bones. They make up the brain case. Now we're going to go in and learn all the individual structures that are inside of those bones. Okay, then we'll do the face. Okay, so like I said, the temporal bone on the side of the head has what's called the external acoustic meatus. What hole do you think this is?
The ear canal.
Very good. The hole for the ear, right? So your ear hole goes straight into this external acoustic meatus. So let's draw that one. Long word. I'd like to think of it like acoustic guitar, right? You hear the acoustic guitar through the external acoustic meatus. Sometimes you see it written as external auditory meatus. Okay, another part of the temporal bone you need to know is the mandibular fossa. So when you see the word fossa from here on out, okay, anytime you see the word fossa, it's going to mean a shallow depression. Okay, it's kind of like a little tiny cave where something can fit in. So right here, there's going to be a mandibular fossa, and it's called that because the jawbone is called the mandible. So there's a part of the temporal bone where the mandible or the jaw attaches, and that's going to be the temporal mandibular joint. Okay, you guys might have heard of this before. Anyone ever heard of TMJ?
Yeah.
Yeah. When people get TMJ syndrome, it's when they have either arthritis or some kind of laxity or pain that's caused right inside this joint, like jaw pain. And we call it TMJ syndrome, okay? So let's draw the mandibular fossa. Okay, that's gonna be this guy right here. Right, remember it's part of the temporal bone, okay? It's not part of the mandible. And then the last part of the temporal bone, the structure you need to know, is called a mastoid process. Okay, another good rule of thumb here. Anytime you see the word process, it's going to mean a bony prominence, like a piece of bone that sticks out. Okay, and processes in the body are really good areas for muscle attachment. So when we learn muscles, you're going to learn about one of my favorite muscles, at least it has a really cool name, called the sternocleidomastoid. Okay, you don't need to know that right now, but it attaches onto the mastoid process. If you can feel right behind your earlobe, there's a big bony bump. That's the mastoid process. Okay. Okay. On the occipital bone, there is a bump right at the back of the bone right there that we call the external occipital protuberance. Let's see if that's something we need to cover. Okay, we need the foramen magnum and the occipital condyles. What do you think this big hole is for? On the bottom of the skull.
The spine.
Very good, the spinal cord, right? So the brain is inside the skull, and then the spinal cord has to exit the skull, okay? Actually, the brain stem, which leads to the spinal cord, exits through this hole here. And we call this hole the foramen magnum. Magnum means great, foramen means hole, okay? Another good rule of thumb, anytime you see the word foramen, it's always gonna mean hole, okay? Foramen or foramen, sometimes you hear it pronounced, okay? So that is the foramen magnum. Let's look at it here. You see how the bottom of the occiput, the bottom of the occipital bone has that hole. And that's where the spinal cord is going to come out, and it leads to the vertebrae, which we'll learn today as well. Foramen magnum. Okay, and then the last part of the occiput we need to learn are the condyles. Okay, so it's hard to see here, but there are these condyles, which are bumps on the bottom of the occipital bone, which allow that bone to attach to the first vertebrae in the neck. Okay, it creates a joint with those. Let me show it to you on here. Okay, you see this joint that is being created with the first vertebrae? The occipital condyles are right here. Okay, so they create that joint. So it's that little bump that you see there. Here are the occipital condyles. So we're going to draw that here. Okay, the sphenoid bone has some structures that you need to know as well. The first structure you need to know is the optic foramen. What did I say foramen meant?
Hole.
Very good, a hole. What do you think optic means?
Eyeball.
Right. It means eye, right? So this is a hole where the nerves of the eye are going to enter into the eye socket. So let's find that. Okay, so see that tiny circular hole in the back of the eye socket? That circular hole is part of the sphenoid bone. Okay, so let's look at it from the top. If we zoom into the sphenoid, we can look through that hole right into the eye socket. Okay, so these holes here are the optic foramen. I'll draw that again on your slides. Oh crap, hold on. I have two different pens. I have one pen that stays on the screen and one pen that I can delete really quick. So I have to use the right one. Optic. Foramen. Okay, that's part of the sphenoid bone. All right. Here's one of my favorite structures. It's called the sella turcica. It is also part of the sphenoid bone and is this little saddle. It's like, if you see it in person, it's like you could put a peanut and that peanut would sit right inside that little saddle. Okay, and it's called the sella turcica. And that translates in Latin to Turkish saddle. Okay, so let's find that, which is part of the sphenoid bone. You see this little saddle right here? There is a gland that you're going to learn in Bio 202 that's going to sit right there called the pituitary gland. Okay, so you have a gland in the brain that sits right inside of there. It's like a little home for it. So that's going to be the sella turcica. From the side, it's right here. Okay, the ethmoid. Remember, the ethmoid makes up the tiny anterior part of the brain case. It looks like this. It has a really weird shape. Okay, you can see it on the inside of the eye socket. You can also see it on the top part of the nasal cavity. Okay, and that's important because it's going to have some structures that are related to the nose and to the sense of smell. So the cribriform plate exists on the bottom of the ethmoid bone. Okay, so if we can find a good view of that. You see here on the ethmoid bone how there's all these holes. These holes are located on the cribriform plate. Okay, so this is the cribriform plate surrounding, not this little pillar going upwards, but the bottom part where the holes are. That's the cribriform plate. The actual piece that's sticking up, that little pillar I was talking about, that's called the crista galli. The purpose of those little holes is for the sense of smell. Okay, so when you smell, the smell goes up through those little holes, through the cribriform plate. The nerves at the ends of those holes pick up that sense, and then the brain is able to process the sense of smell. Those are part of the ethmoid bone. Okay, but also it's very important to remember that it makes up the medial aspect of the orbit, or the eye socket. All right, I'm gonna do the facial bones and then we'll go back to Kahoot, okay? Any questions on those that we just learned? Great.
Quick,
Yeah.
would you please go back to the picture that you wrote everything?
Yeah, of course. Is there a specific one you want to see?
Yes, I just didn't catch up really quick.
Is this the one you want to see, or?
Yes, thank
Okay.
you.
Yeah.
So my question is that when we take the practical at the end of this, when we talk about like, the mandibular fossa and everything, are we supposed to put of the temporal bone at the end of it, or do we just put like mandibular fossa or?
The question will kind of guide you in the right way. It will say if you need to or not. Sometimes you will, sometimes you won't. Most likely you will need to.
Okay, thank
Yeah.
you.
But sometimes it might be like a fill in the blank. And in the blank, it'll say of the blank of the temporal bone. So you, in that case, you wouldn't have to, but just kind of follow the directions and it'll tell you what it wants. But that's a good question. Sorry, was that enough time for you?
Yes, thank you.
Okay. All right, so the facial bones include these here. These are fun to learn. I like learning these ones. Okay, so let's start with the mandible. The mandible is the jaw. Okay, so you have this guy here, which is the jaw, and it attaches only to the lower teeth. Okay, so let's find that. Okay, we need to learn some of the processes of the mandible. So first you have the coronoid process. Okay, that's this guy here. That goes up under your cheek. Okay, what did I say it was called?
The coronoid process.
Very good. I'm gonna draw it going down. Okay, remember process always means a bony protrusion, a piece of bone sticking out. And then we have the mandibular condyle. So this mandibular condyle fits into this groove. What is this groove called? We just talked about it.
Mandibular fossae.
Very good. Mandibular condyle. Here's a good view of the mandibular fossa. I probably should have drawn it here, of the temporal bone. Okay. Next bone of the face is the maxilla. This attaches to the upper teeth. Unfortunately, this guy's tooth got chipped. There was a guy in high school that used to bully me a lot. And I always wanted to hit him in the face. His name was Max. So this is going to be the maxilla. No, I didn't want to hit him in the face. I was too shy. I was kind of nerdy. I was in marching band. Was anyone else in marching band?
Yeah, cover it up.
Cover
You know, you knew you really wanted to hit him in his face.
I can't promote violence. I'm sorry.
That's what I said when you said that. I said, oh, so violent.
So that is the maxilla. That makes up the cheeks, okay? But it's not the cheeks that you think of, not cheekbones, okay? Important distinction there. Not the cheekbones. We're talking like this area of the cheeks where the lower teeth are attaching, right here, okay? Because the cheekbones are going to be a different bone. That's why that's important. All right, next bone.
Or is there an E in maxilla?
Sometimes I see it spelt with both. Is that what it said on the PowerPoint?
Yeah.
Yeah, let's do it with an E. I've seen it spelled with both.
I was just double checking.
No, thanks for checking. It's a good question. Next is the palatine bones. The palate is the roof of the mouth, okay? So the roof of the mouth is going to have bones that we call the palatine bones. Sorry. All right. Another bone on the inside of the eye socket, a very tiny guy, is going to be the lacrimal bones. Let me give you a better view of this one. See how it's on the inside of the eye? That is the lacrimal bone. You see this little hole right here? What do you think that's for? What does lacrimal mean? Anyone know what lacrimal means? Lacrimal means tears. You ever cried and after you cry, your nose is really runny? That's because there's a hole right here called the lacrimal canal that leads from the eye socket to the nose. So when you cry, you also cry through your nose. A bone inside the nasal cavity is the vomer. Let's look at the vomer. This one has a confusing shape. It's just like this long, skinny one. Sometimes it's called the nasal septum. Okay, separates the left and right nasal cavities. So it's this wall right in the middle. What did I say that was called?
Vomer?
Good. Vomer. Okay, I didn't draw it all the way to the top because the top portion is part of the ethmoid bone. Remember, the ethmoid reaches downwards. Inside of the nasal cavity, you're going to have these bumps on the lateral aspects of the nasal cavity that are called nasal concha. Okay, the nasal concha are what help create turbulence inside when you breathe in. When air kind of gets in there, it goes crazy. It creates turbulence and it allows all the air that you're breathing in to become warm and moist. So the purpose of the concha is to create a turbulence of air so that all the air can be moistened by your nose. And that's going to be this guy, this bony part here.
Will it be the top and the bottom or just the bottom one?
Looks like we're not learning the bottom one, but this one would be called the middle nasal concha. Let's see if that's on your. Yeah, it looks like all you need to know is the inferior one. Let me see what we have. All right, let's go ahead and take a break. It's 1 hour in. Let's take a 5-minute break. I'll be here to answer any questions you have. My computer's fan is running like crazy, so it'll be a good chance to give it to relax for a second. I have so many programs up. But get back here at 11:05, okay? And we'll move on to the cheekbones, which are called zygomatic.
Can you just put the one with the labelings on there so I could catch up?
Of course. Let me know if you need me to move it up or down.
I meant the one with all the other ones, the ethnobone and yeah.
Which, this one here?
Yeah, that one.
Can you read it okay? All right, 5 minutes. I'll be back.
Are we gonna go over the one that says the anterior and inferior view?
This one here?
No, the ones with the lines on it. This paper. Let's see. Can you see it?
Oh, yeah, so that is the other one. Okay, so remember when I was showing you, this one, this lesson here, and I
Yeah.
said that there's two sets of diagrams,
Mm-hmm.
and I like this one better. So I'm going through this one. Okay, but if you want, you can draw on this one too. You just have to kind of get an idea. So I'm not going to go over this one. It's kind of the same.
Right.
Yeah. There is one thing I'll show on here, which is when I go over the spine. I like showing the spine on this one. Okay.
Cool, thanks.
You're welcome. All right. Let's jump back in. We got to finish the face and then move on to the spine and vertebrae. So the cheekbones have a cool name. It's called the zygomatic bone. The zygomatic bone is here. Okay, and notice how like it has very distinct cutoff lines. So this is the zygomatic bone. It makes the outside part of the eye socket, and then it makes the cheekbone. Okay, so when people are talking about your cheekbones, they're talking about your zygomatic bone. So that's going to be this. Okay, here's an easy one. The very top of your nose is called the nasal bones. So it's this guy. Okay. All the rest of it, as it goes down, is just made of cartilage. This is a question that you should be prepared for because you will see this question on your exam. Which bones make up the orbit? Okay, so we've learned all of these bones. We just kind of didn't look at the eye socket as a whole. Okay, so the top of the eye socket is the frontal bone. The medial aspect of the eye socket is made up of ethmoid in the back of the eye socket, lacrimal towards the front, Okay, that's the medial side. The lateral side, okay, more towards the back, you have sphenoid. And then on the very lateral side is zygomatic. And then the bottom part of the eye socket is made of the maxilla. Okay, so if we zoom in here, so here's the frontal making the top. Okay, what is this one here? That's sphenoid. How about this one? It's all part of this.
Zygomatic?
Very good, zygomatic. And the bottom, maxilla. Okay, and then the medial side, you have two, one small one here, lacrimal. And behind it, what is this?
Ethmoid.
Very good. Okay. I don't have a really good place to draw all of those, but okay, make sure you get that part down. This is a good slide for that. Okay. The last bone that's considered part of the axial skull, but it's not part of the skull itself, is the hyoid bone. Hyoid bone is weird. It's like free floating in your throat. Right here. There are muscles that attach to this bone that help move the tongue. Okay, so it's not actually connected to any other bones. It is by itself held up by ligaments and muscles. Looks like we don't have a hyoid to label. Okay, so just remember that one. Now we're going to move on to the vertebral column. The first thing I want to talk about the vertebral column is curvatures. So a normal spine curvature looks like this. Okay, it's going to start off here, and it's going to do one of these curves first. So the inside of the curve is facing backwards. Okay, then it's going to curve forward like this. So the inside of the curve is facing forwards. Then it's going to curve back again, where the inside of the curve is facing backwards in the low back. And then finally at the end, it's going to curve forward again, and the inside of the curve is facing forwards. This is normal. Why do you think the spine is like this? What would it be like if it was just a straight spine? Kind of like a slinky almost. Like you want to be able to compress it, right? It makes the human body able to take impact, okay? If we fall, right? The spine has some give to it, right? As opposed to if it was just straight, it would be very rigid and more likely to get injured. So these curves are important, okay? Let's start with kyphosis. Kyphosis are the curves that point forward. That's what you call kyphosis, is when the inside of the curve is facing forward. And if you have what's called an exaggerated kyphosis, that means that curve is accentuated too much and you're leaning too far forward. Okay? The other way in which the curves are facing backwards, the inside of the curve faces backwards, is called a lordosis. And if it's exaggerated, then you'll be leaning too far back. Okay, and this is a major problem in people with low back pain, is they have lumbar lordosis, especially when they're pregnant. They're having to lean back too far, okay, because they might, be pregnant. They're leaning back too far, and they're exaggerating their lumbar lordosis. Scoliosis is a little bit different. It's not a side view. It's a view from the front or back. This is abnormal. There should not be any curves if you're looking at it from the front. It should look straight like this one. Okay, so from the front or back, the spine looks straight normally. But from the side, it should have normal curves to it. As much as I love the tunes, please mute yourself if you're not talking. All right, one thing I want to do before I start the vertebrae is go to your other sheet, which is this one. Okay, there's going to be 3 regions to the spine. Okay. Who knows what the neck region is called? Do you guys remember?
Cervical.
Good. Cervical. What about the mid-back?
Thoracic.
Good. Thoracic. Looks like I don't have a good label for that. So from here to here, it's going to be thoracic. And then the last part of the spine is called?
Lumbar.
Good. Right. You're going to have 2 more parts at the bottom, and that's going to be sacrum and coccyx. That's a Y. But let's just talk about the first 3 to start, okay?
Do we have this page?
I don't know if it was in your packet, was it?
Yes, it's in the packet.
I can't find this paper.
Okay, so it's called Axial Skeleton Diagrams. What page is it in the packet? Can anyone help with that?
Doesn't say what page it is.
Is it after the other diagrams or before?
It's let's take a look. Actually, it's the first one.
It's before the other ones? Okay, so see if you can go back.
There's 2 diagrams that you told us to print. And this is the first diagram that we're supposed to be printing out.
I guess what I'm asking is, was it part of the packets that you picked up or no?
No, I can't find them.
Okay.
I don't have it neither.
Yeah, so I posted an announcement yesterday. It's okay if you don't have this one. Like I said, I'm not going to use this one very much. I just want to show it on here real quick, okay? I'm not going to fill out this whole page. But I'm just going to do this, okay? So it's okay that you don't have it. I just want to point out to you that there's 3 major parts of the spine: cervical, thoracic, and lumbar. And each of them have a vertebrae. So each of these tiny bones here are called vertebrae. And each section is going to have a different number. And the way we remember them is cervical is going to have 7 vertebrae. Thoracic is going to have 12 vertebrae. And lumbar is going to have 5. And the way I remember that is breakfast, lunch, dinner. Okay? So you have 7 cervical vertebrae where you have lunch or breakfast at 7 a.m., right? Then you're going to have 12 thoracic vertebrae, which is lunch at 12 p.m. And then at dinner, this is kind of an early dinner. I usually have it later, but 5 p.m. is dinner time. Okay, so breakfast, lunch, dinner, 7 a.m., 12 p.m., 5 p.m. That's how you remember how many vertebrae are in the spine. Okay? The sacrum and the coccyx don't have individual vertebrae, but they are the bottom part, the tailbone of the spine. So how many vertebrae are present in the thoracic spine?
12.
12. How about the lumbar spine?
5.
5. And how about the cervical in the neck?
12. 7.
7.
7. Very good. Remember, breakfast is 7 a.m. So each of those vertebrae have a special shape. We're going to learn about what they look like, okay? The first thing you want to know is the vertebral foramen. Remember, what did foramen mean again?
Oh,
The hole, right? What do you think goes through this hole?
Nerves.
What was that?
The spine.
The spinal,
There's
the spinal,
Nerves.
right? So when you say spine, you have to say spinal cord because spine includes the bone. Okay, so when we're talking about spine, that includes the bone, but spinal cord specifically goes through the hole. And then here, this big bulky part is called the vertebral body. Okay, so the vertebrae, all of them have a vertebral body and a vertebral foramen. And the way they line up is like this, look. So the vertebral body is in the front, and then the foramen is in the back, the hole. Okay, and they stack together like this. One thing I forgot to mention, the way that we name vertebrae is by a letter and a number. So the first vertebrae is a cervical vertebrae. So we write C, and then we write a number. So this is C1. So what is this one going to be?
C2,
And this one?
C3.
Good, and so on. C7, what is this one going to be?
T1.
Nice job. Trying to trick you there. Okay, so remember the thoracic starts after the 7th cervical, so it'll be T1, T2, T3, T4, all the way until T12, and then it'll be what?
L1.
L1 through L5, correct. Okay, let's go to our vertebrae here. So here's a cervical vertebrae. Let's draw the vertebral body. And what is this?
Foramen.
Good. Vertebral foramen. Now we're going to have processes. You remember process means bony prominence, right? So a bone that sticks out. The part that sticks straight backwards, you ever seen the back of someone's spine and it looks like you can see their vertebrae? That is the spinous process sticking straight backwards. And then the transverse process is going to stick sideways. Okay, so when you look at the spine, you see these tips that are going straight back. Which process is that? What was it?
You said the spiny process.
Spinous, very good, spinous. Okay, and then you're going to have the ones that go to the side, which are the transverse process. So we'll draw it on this one. All of the vertebrae have this, okay? But here it's very pronounced. Now, like I said, they all have a similar shape, but it's a little bit different. Like the cervical vertebrae are small, and the lumbar vertebrae are big, and thoracic is somewhere in the middle. So the cervical vertebrae are special. Cervical vertebrae have something on the side here. They have an extra hole Okay, did the other two have that hole?
No.
No, right? So this extra hole here, it makes the cervical vertebrae special. And there's going to be an artery that runs from the heart up to the brain. That's why this hole is here, for a specific artery, okay, called the vertebral artery. So it's going to run through that. So that's special. If something asks you where a transverse foramen located, you would say only in the cervical vertebrae. So if you see a picture of a vertebrae, like this one, you would know it's not cervical because it doesn't have the holes. Here's a cervical because you get the holes on the sides, or here and here. Okay. So what is this called?
Transverse foramen.
Good. All right, remember how I said we name vertebrae with a letter and a number? There's going to be one exception to that, okay? What I want you to do is I want you to forget about C1 and C2. They have special names. C1 is going to be called atlas, and C2 is going to be called axis, okay? They're special because they will allow the head to make certain motions. Okay. The head obviously has way more range of motion than the rest of the spine. You can move the head forward, backward, rotate, go like that, right? So they have a special shape that allows for certain movements. Atlas is what lets you shake your head up and down like this in a yes motion. Axis, C2, is what lets you rotate your head in a no motion. Okay, so they are a little bit more special. If you also notice, axis doesn't have any transverse processes, like it doesn't have the bumps on the side, but it does have a special structure that sticks up called the dens. Okay, here's atlas. And here's axis. You see how it has that pillar right there? That's very specific to C2 or axis. Okay, so here we have atlas, C1. And here we have axis or C2. Okay, they both have the vertebral foramen. Sorry, the transverse foramen. So you have it here as well. But axis has a special structure right here. What do we call this thing?
Dens.
The dens. Thoracic vertebrae look kind of funny to me. They look like a giraffe. Like here's the nose and here's the ears. It looks like, you know, a bunch of giraffes stacked on top of each other. Do you guys agree with that?
Yeah.
Yeah. So if you see something that looks like a giraffe, that's how you know it's a thoracic vertebrae. Okay. So if you see something that has holes in it, that's what kind of vertebrae? If it has two holes on each side, it's a what?
Cervical.
Cervical. But if you see one that looks like a giraffe, then it's a thoracic. And it's going to have the same structures. Remember, it has these prominences on the side, which are called what? The ears are the transverse process, and the nose is the spinous process. Okay, but remember that this is the posterior side, okay? So don't get confused thinking that if this is the front, this is actually the back. And lumbar kind of looks like a moose to me. Do you see like a bunch of moose heads stacked on each other? Does that look like a moose to you?
Yeah.
Yeah. Okay. It's a bit bigger, right? It's got bigger ears. It has like these horns on it. okay, and a big nose. So the lumbar vertebrae looks like a moose, and it has the same structures as well, okay? It's going to have the spinous process facing backwards and the transverse process facing to the side. It's going to have the vertebral body and the vertebral foramen, okay? So that's lumbar. How many lumbar vertebrae are there?
5.
Good, there is 5. Okay. So here we have all of our mooses. How do you say moose plural? Here's all of our mooses.
Moose.
Is it just moose? Is it meese? Here's all of our meese. No, it can't be meese. And here's all of our giraffes. Okay. So here's the lumbar.
Yeah, it's moose.
It's just moose. And here's our thoracic. So here's all 5 of our moose, plural. Moving further than the lumbar, you're going to have the sacrum. Okay, the sacrum used to be 5 separate bones, but it fuses when you're developing in mom's womb. Now it's just one bone. It's the sacrum. Okay, it's right underneath the lumbar. So here's sacrum. Special structures of the sacrum are the sacral canal and the sacral hiatus. So the hole on the top and the hole on the bottom. And then each of these little holes on the side are sacral foramina. Okay, so there's going to be a hole here. Which is the hiatus. And then there's going to be a hole. It's more on the front side, but what is the hole on the top? And then these holes on the side are sacral foramina. Okay. Foramen is singular, foramina is many holes. Okay, so if you're just pointing to one hole, it's a foramen. But if you're talking about all these holes, plural, it's foramina. Who knows what the tailbone is called?
Coccyx.
Coccyx, very good. Okay, a lot of people get this confused for some reason. The coccyx is separate. This piece right here, this tiny piece, is the coccyx. C-O-C-C-Y-X.
Or what a lot of people call the butt bone.
It's the tailbone. Tailbone, yeah. I would say I don't know. I would say the butt bone is more of like going to be part of the pelvis. We'll learn about it. Like this one here. This is the butt bone. All right, lastly, we need to learn the ribs. Okay, so the ribs are all going to attach to the sternum. Where is the sternum? Can you point to it on yourself? Right here, right? Sternum. Who's certified in CPR? Cool. So you know that you're supposed to press on the sternum for CPR, right? What's supposed to happen if you're doing CPR right? What will happen on the first push?
You're gonna crack those ribs.
The ribs are going to break, right? If you're not breaking the ribs, you're not doing
You
it.
ain't doing it right.
Yeah. Okay. But the whole point of it is to be able to push the sternum to squeeze the heart. Okay. Because the heart's not working on its own. So you want to push on this lower part of the sternum so that it comes down and it squeezes the heart every 100 BPM. What is the tempo that you're supposed to push CPR at?
It's 1,000 to 1,000 to 1,000 for 1,000. So it's like
Staying
every
alive.
second.
Right. Yeah. It goes to the song of "Staying Alive," right, by the Bee Gees. Staying alive, staying alive. But you shouldn't sing it while you do it, just because that's inappropriate. I mean, it's a medical emergency we're talking about. Okay, but have it in your head if you need it, right? Have you seen The Office?
God.
Have you seen the episode of The Office where they get the CPR girl to come in, and you know they're so dumb. Like she starts doing CPR and they get so distracted that they just start dancing to "Staying Alive." It's like staying alive, and then Andy's just well, you can tell by the way I use my walk, I'm a woman man, no time to talk, right? And then she's like, "Your patient died, you guys. They're so immature," right? And then Dwight like peels off the guy's face, and he's weird. Okay, but this is the sternum. This is where you do CPR. Okay, so let's look at the sternum on the skeleton. Right here. Okay. Here you have it. There's 3 parts to it. There's the top, which is the manubrium. There's the body in the middle and the xiphoid process, okay? So the X sounds like a Z. So let's draw it. Manubrium. What is the middle?
Body.
Body. And the bottom?
Xploit process.
What does the X sound like?
Xiphoid process.
Xiphoid. Xiphoid. This is where the ribs are going to attach to in the front. Okay. So if you looked on the skeleton here, we're like, why are these ribs just hanging there? Why are they not connected? It's because the connection is actually made of connective tissue. So you have to add cartilage. So there's different types of ribs. First off, let's just remember that there's 12 ribs on each side. So how many ribs total?
24.
24 ribs total. The first 7 are what we call true ribs. Okay, 1, 2, 3, 4, 5, 6, 7. What makes it true is that the cartilage of the rib is attaching directly to the sternum. False ribs are ribs 8 through 12. The reason it's false is because the cartilage is not attaching directly to the sternum. It's attaching to the cartilage of rib 7. That's what makes it a false rib. Okay, and then 11 and 12, which are considered false ribs, but there's a special type of false rib called floating ribs. They're not even attached to anything. They just float there. You could feel it. If you feel back here, like right down here, you might be able to feel the tip of those ribs 11 and 12. See? See how they're just sitting there? Rib 11, rib 12. So how many true ribs are there total?
7.
Total, left and right.
14.
14. That's it. Let's see if this Kahoot works. I'll do 5 questions on here and then we'll see where we're at. Do you guys still have this Kahoot open?
Yes.
If not, you can probably still join it.
It logged me out.
Try rejoining it.
Do you have the number?
Yeah, can you see it down here? Is it showing up? Let's try it. What bone is this? Good job, guys. That is the nasal bone. Tiny bone right there. Very good. That is the lacrimal bone. Very good. Hyoid. What structure is this? Very good. That was a tough one, right? This is the occipital bone. These occipital condyles on either side of the foramen magnum, right? That's what attaches to the C1 or atlas vertebrae. Very good. Foramen magnum. That's a little peanut holder there. You guys are really impressing me right now. Nice job. There's a little hole that goes diagonal there. Good. That is the optic canal. That's where the eye nerves go into the eye hole, into the orbit. Who can tell me what bone that was part of, that optic canal?
Is it the sphenoid?
Sphenoid, very good, sphenoid. Good job. External acoustic meatus. Okay, and again, a reminder, try and see if you can do it without looking at the options. That's a great way to test yourself. Oh. Sorry, we didn't learn that one. Good, mandibular fossa. What bone is that part of? What bone is on the side here? That's part of the temporal bone, mandibular fossa of the temporal bone. Mastoid process, very good. Here's what I'm going to do. I'm going to do one more of these, and I'm going to send you this Kahoot, and I want you to practice on your own, okay?
I got my 5-year-old sister learning this too.
Nice.